Hi, my name is Jasmine Prieto, and for my 5th sports med project, I am doing rehab for a hip replacement. What is rehab and why is it important? Rehabilitation is a program that helps you recover after a surgery or an injury. It's super important because it helps you regain strength, flexibility, and mobility. It also teaches you how to do everyday activities safely and reduces the risk of complications. Basically, it helps you get back to your normal life as smoothly as possible. Causes. Injuries that can lead to hip replacements are osteoarthritis, which is wearing and tearing of the joint cartilage, rheumatoid arthritis, which is an autoimmune condition causing joint inflammation, hip fractures, which are breaks in the hip bone, often from falls, a vascular necrosis, which is loss of bone tissue due to lack of blood supply, and childhood hip disease, conditions like hip dysplasia that can affect hip development. Hip replacements. There are a few different types of hip replacement surgeries and prosthetics. The most common type is a total hip replacement where both the ball and the socket are replaced. Then there's partial hip replacement, which only replaces the ball. Lastly, there's hip resurfacing, which is less common and usually for younger, more active patients. As for prosthetics, they can be made from metal, ceramic, or plastic. Metal on polyethylene is the most common because it has a good balance of durability and cost. Ceramic on ceramic and metal on metal are less common due to higher costs and potential complications. Success rates are generally high with about 90 to 95% of total hip replacements lasting at least 10 years. Age-wise, most patients are between 50 and 80 years old, but younger and older patients can also benefit depending on their condition and activity level.
During the procedure, the femoral head and acetabulum are replaced with artificial components called prostheses. An artificial hip prosthesis consists of a cup called the acetabular component and a metal stem called the femoral component. Your surgeon will begin by making an incision overlying your hip, separating the muscles and ligaments to expose the joint capsule. After incising the capsule, your surgeon will dislocate the femoral head from the acetabulum. He or she will remove any damaged cartilage or bone in the acetabulum, reshape the acetabular socket, and secure the acetabular prosthesis in place using special cement or screws. Turning next to the femur, your surgeon will remove the femoral head, shape the remaining femur to fit the prosthetic stem, and secure the femoral component using cement or other techniques. Once both components are firmly in place, your surgeon will slide the prosthetic femoral head into its acetabular counterpart.
To summarize, hip replacement surgery involves replacing a damaged hip joint with an artificial one using different materials. The first phase of rehab is immediate post-op, which is between 0 and 2 weeks. The goals for this phase are to reduce pain and swelling and begin gentle movements. The focus is on mobility and pain management. Some exercises that can be done during phase 1 are ankle pumps, which improve blood circulation, prevent blood clots, reduce swelling, and keep the lower leg muscles active. Gluteal sets, which help strengthen the glutes for stability and movement. And quad sets, which help strengthen your quads without moving your knee joint and reduce muscle atrophy. The second phase of rehab is early recovery, which is 2 to 6 weeks. The goals for early rehab are to improve range of motion and start weight-bearing exercises, whereas the focus is on mobility and strength. Some exercises for phase 2 are heel slides, which improve the range of motion in your knee and hip and also strengthen the muscles around these joints. Mini squats, which strengthen those muscles as well and also improve balance and stability. Standing hip abduction, which strengthen the gluteus medius to improve stability and balance. And lastly, standing hip extension, which strengthens the muscles in your lower back, glutes, and hamstrings to improve strength and stability. Phase 3 of hip replacement rehab is intermediate recovery, which is 6 to 12 weeks. The goals are to increase strength and mobility and reduce reliance on walking aids. The focus is on strength and proprioception. Some exercises would be side-lying hip abduction, which targets the gluteus medius to strengthen it and improve balance and stability. Then standing on one leg to improve balance and awareness of your hip in space. Next is step-ups, which strengthen your quads and glutes and improve balance coordination. Then lastly is stationary cycling, which improves your range of motion and strengthens your leg without putting too much stress on your hip joint. Phase 4 of rehab is advanced recovery, which is between 3 to 6 months. The goals for this phase are to return to normal activities and improve endurance, and similarly, the focus is advanced strength and endurance. Exercises for advanced recovery are single leg balance, which improves balance and strength, swimming or water aerobics, which supports your body and reduces stress on the hip joint while still allowing a good workout, helping your range of motion and strength. Lunges, which strengthen your quads, glutes, and hamstrings. And lastly, leg curls, which strengthen the hamstrings to improve overall stability. Along with these exercises, you can also gradually return to low-impact activities. The final phase of rehab is return to activity, which is 6+ months. The goal is to have full return to daily and recreational activities while the focus is on functional training and maintenance. Some exercises can include sports-specific drills, if applicable, continued strength and conditioning, and high-level proprioception exercises. Some factors that can affect the rehab program are your age, health problems/underlying conditions, your diet, support system, motivation and confidence, and lastly, how your healthcare provider personalizes your rehab program. Some complications after hip replacements can be infection, either at the incision site or deeper around the new hip, blood clots, which can form in the legs and travel to the lungs, dislocation, which is when the new joint can sometimes pop out of place, or leg length difference, which is when one leg may end up slightly longer or shorter than the other. Movements to avoid. After surgery, before rehab is successful, you want to avoid high-impact activities like running, jumping, or heavy lifting, twisting motions, which can be in sports like golf or tennis, deep squats or bending, which put too much pressure on the hip, and lastly, crossing your legs, which can increase the risk of dislocation. In conclusion, hip replacement rehab is all about consistency and patience. Following your tailored exercise program will help you regain strength, flexibility, and stability. Always listen to your body and consult your healthcare provider to ensure you're on the right track. With dedication and the right support, rehab will get you back to your daily activities. Thank you.